All right, good afternoon. We're here with Denise Erez, formerly Denise Neuer, as I knew you,
Yes.
when you were pregnant with my wife. You guys were both pregnant at the same
At the
time.
same time, yeah.
And we had two wild boys, if my memory is correct,
That's
right?
right.
I hope yours is more mellow than mine.
Yeah.
'Cause that's
He's
probably a no, right?
He's a
Yes.
teenager. Yeah.
And Denise is from AIM Women's Wellness Center. And we had the pleasure of working together for many years
Yes.
when our IVF lab was in Westlake Village before it moved here to Encino, and then you joined us in Encino. And so you were really the first person that I got any real deep knowledge and exposure about acupuncture. And I think the first question that everybody asks me, because when I say, hey, why don't you go see Denise in her office and see, how could she be of help to us, is what is the difference? Explain it to our audience between fertility acupuncture and regular acupuncture.
That's a great question because fertility acupuncture, you would think that acupuncture is acupuncture, but reality, the fertility journey itself is so massive and there's so many moving parts from, with the changes in the body to the emotional piece. And so somebody who really is well versed in that as a fertility acupuncture can really support the person, the couple, the woman much more. So there's different things as far as like being able to collaborate with the doctors, understanding the testing that needs to be going on. I mean, imagine if you're treating with an acupuncturist and you're not getting pregnant and then you find out that you don't have any sperm and they never referred you to a medical doctor to get tested.
Happens all the time,
It's
right?
it's
Yeah.
horrible. Yeah, it happens
Not with you, but we see that
yeah.
people coming in saying I did, some adjuvant care and nobody checked this or nobody checked that.
Yes, right. It's a big concern. So you want to make sure you're with somebody that really understands that journey.
So, how long does it typically take to see results from this type of treatment?
Well, it's usually not a one and done, which oftentimes people think. So it's going to depend, though, on the goal. So acupuncture can be effective for many different situations. So, for example, if somebody comes to me right before they're going to do their IVF procedure, they already started their medications, I'm not going to be able to really help them with a quality at that time. So in that moment, we're going to be really focusing on helping them calm their nervous system, increasing circulation, decreasing inflammation, and that type of thing, working with the medications. But if somebody wants to come in for a quality, which I get a lot of calls for, then it's going to take at least 3 months for that whole egg cycle or in the sperm cycle to completely regenerate and to really get those effects. So it's going to depend. But if someone has like painful menstrual cycles, then we can get results within that first month.
Oh, wow. Are there any specific lifestyle or dietary changes that should accompany your type of treatment for better results?
Yes, absolutely. It's such a big piece of what I do is working with these clients because imagine, you're coming in, they're coming in, they're relaxed, they're feeling good, and then they go and they stop by McDonald's and get a French fries, which was a thing at one point, right? And a Diet Coke. I mean, it's completely it backfires. You're putting all these toxins and stuff in your body. So absolutely, looking at lifestyle um, is really important as far as nutrition, supplements, how they manage stress makes a big difference.
Sleep hygiene, probably.
Sleep,
Yeah.
digestion.
I mean, that's what I tell my patients is, focus on at least three measurable things that you can do. If you're sleeping 6 hours, try to get 7 or 8. If you're drinking 3 cups of coffee, try to go to 1.
Mm-hmm.
If you can't have 3 balanced meals a day, at least do 2. Try to minimize it. I think it's hard to get patients to change these types of behaviors overnight. So, if we can give them some, very easy 1, 2, 3s,
Yes.
I think that's been easy on in my practice. I don't know if your practice would be something similar.
It can be. It depends. Like we have those people that want to go all out, right?
And they could do it from day one.
And they could do it from day one, and then
Those are incredible humans. I'm not one of them. I had fries for lunch.
Yeah.
Monica, thank you very much.
Fries.
Yes. So that's great that some people can really, just jump into that.
Some people can, and sometimes that with the fertility patients, there's that pressure, right? A lot of them have that timeline, that pressure that they're racing up against.
Of course, they want to be pregnant yesterday.
Exactly. So a lot of them want to do it quickly, but absolutely making small changes makes a big difference. Absolutely.
Let's discuss a little bit about some myths or misconceptions about fertility acupuncture that you could dispel for someone who's skeptical in this type of treatment. What do you tell them? Maybe you could discuss some of the physiologic things
Mm,
that you've seen some studies show and help. I think that would really help our audience.
sure. One thing that I wanted to talk about was the needles. People are afraid of the needles, but they're really these small hair-like needles, and they shouldn't hurt. I mean, sometimes they'll get places that will be sensitive, but it shouldn't hurt.
Mhm.
So that's one thing. And then as far as the physiological
Well,
response,
let's talk about where you generally put the needles.
okay,
I think it would help to
yeah,
know.
you're right.
Yeah.
You're right.
Where are they going?
They're not going in the genitals.
Yes.
That's like the big
That's
one.
I think that's very important to know.
It is. You're right.
Because some patients, that may be the one they think, oh my God, she's going to put them there. That's no good.
Yeah, you're absolutely right. There is a point there, but we don't usually do that point. But
Tell us
but yeah,
about
we
the
don't.
point. No, I'm kidding. Okay, so where do they generally go?
They usually go all over the body.
Okay.
So, like for example, if I put a needle in the hands and the feet, not only does that calm your nervous system, but it increases circulation to the reproductive organs.
So how many are going in the hands? How many are going in the feet? And is it both hands and both feet?
it really depends on.
What's it depend on?
It depends on what's going on with that person and
I
the
see.
situation. So sometimes I do by equal
Uh-huh.
sides, and sometimes I'll do different different points on different sides.
Oh,
So
interesting.
yeah, it just really it's so
Depends on the need of the
individual.
patient.
It really does. It
Okay.
really does.
But why don't you give the audience, just so they know, because some people have no idea, are we talking about 10 needles total at any one time? Are we talking 4? Are we talking 8,
No, I
20?
usually put around 20, 25 needles in.
Okay.
Yeah. And
And how long do they stay in?
they stand for about 30 minutes.
Okay.
Yeah, it's an average of 30 minutes. And usually what happens is
And it takes you about 5 minutes to put them in?
sometimes you're talking, so yeah, 5 or 10 minutes.
Okay. And so they lay there for 20 to 30 minutes,
Right.
and then you come and you take them out.
And then I come and take them out. And then within the first 10 minutes or less, that's when their nervous system starts to calm down. Like
Mhm.
the alpha brainwaves start to kick in, and they start to get into this completely relaxed state. And so it's
And
really
they're in
nice.
their forehead. I know I've seen them in their
I
forehead.
have done, yeah, there's a point
Right.
here to calm.
Right.
Yeah.
Where else? Arms?
So usually I'll put it in the head, the ears, the hands, the legs, and the feet, and the abdomen, of course. Yeah.
My abdomen's a
Local
little bit
points.
larger. Would I need more needles?
You need a little thicker one, a little deeper one.
Sounds like
No.
something my wife would say. Okay, let's move on. Now that we know the areas and that I need a thicker, larger needle, most of our patients will be fine, right? Most of our patients will be fine.
Yeah. No, really, it shouldn't hurt. I want to
No,
just
I've done
leave
it
off
before.
with that.
It doesn't hurt.
Yeah.
But let's continue. So
Okay.
the myths and misconceptions. The needles, they're small. We've gone
Right.
over the locations
Yeah.
and the duration. So what are the myths and misconceptions that we need to dispel?
Well, I think that it hurts, and that and understanding what it does in the body, and not having it think that it's a one and done type thing. It's more of an accumulative process. So I think just like if you were going to physical therapy or if you were doing weight training, there's a cumulative effect over time. It's not just you're going to lift a 10
Sure.
do biceps and then
Sure.
you're done and off your muscle, right? So it really takes time, accumulative effect.
So tell me a little bit about how you believe the acupuncture is improving blood flow and improving the possibility of egg or sperm quality. Because patients ask me, if you're giving me these supplements or vitamins like Proxy, etc., what is the mechanism? And I tell patients that it's very difficult to scientifically prove this in placebo-controlled studies. So we have some studies, they're limited, but we believe that there is a antioxidant effect of these vitamins and supplements that may potentially have a benefit on the cell division, the DNA, the way the cells are replicating and reacting. So I think it would be great in a blurb to tell us how you think it affects with the acupuncture.
Okay, so first of all, that's kind of two separate questions. So I'll start with the acupuncture piece first.
Okay.
So I wouldn't necessarily say that acupuncture itself improves egg quality. It definitely improves ovarian function because it's working through the hypothalamus pituitary ovarian axis, the brain ovaries, how they talk to each other. And so we know that, and there's tons of research that show that effect. For
what, like cycle regularity or something?
For cycle regularity,
Okay.
hormonal balance.
Okay.
So also acupuncture again helps with circulation. So we
Yes.
know that we've done Doppler studies to show that
Sure.
it increases the blood
Blood
flow
flow.
through the femoral artery. So we know that those things are very happening. Calming the nervous system is another one, which is going to affect your whole body in
Yes.
healing, right?
Yes.
So those in that specific way for acupuncture, it's amazing. But as far as egg quality goes, what you described was exactly right. You know, having the right supplements to help with ATP in the mitochondria so that the cells have more energy, or helping the DNA structure. So because as we age, the DNA structure starts to fragment, or protecting the cells from
Oxidative stress
oxidative stress.
or telomere activity or something like that. It's
Exactly.
complicated.
It's very
Yeah.
complicated, and again, and the thing too, though, with egg quality that we all have to remember is it takes at least 3 months for the full cycle. So that's part of the thing. And then there's supplements that help with inflammation, right?
Yes.
And
What do
that
you
can
usually
also
suggest
be
about inflammation?
for inflammation. I usually incorporate diet, stress management, acupuncture, and then for supplements, I like a good turmeric, good quality fish oil. Those pretty
Or
basic.
well for inflammation?
Yeah.
So we talked about some of that. We talked a little bit about optimal time to start. I guess you would say 3 months before, whether you're doing IVF or IUI, at least.
At least is as ideal in an ideal world it would be. I mean, when a couple when they're pregnant, they're already planning the nursery months before.
Sure,
So
sure.
if they took that mentality and actually had that preventative thinking and started planning and thinking and asking themselves questions like, maybe I should stop drinking, or how is my body? How am I managing stress? Asking themselves those questions beforehand and making a plan to prepare, that would be ideal.
Perfect. Okay. Can acupuncture help with side effects of IVF medication? And
They
what are some typical ones your patients uh, really kind of vent with you about?
They can okay. They can absolutely help with side effects. Mostly the
The
bloating
bloating,
and
yeah.
the discomfort, and sometimes, although I've seen it less often lately, but sometimes if they're irritable and moody, can really help with that type of
And you can tell them
situation.
that the needles that I'm prescribing are much bigger than the needles that you're prescribing, right?
They are.
I mean, we're using 25, 27 gauge. I mean, yours are much smaller. How about, how does it kind of, let's talk a little bit. I know we talked a little bit about improving egg quality, but we didn't really talk about sperm quality. So how about sperm quality for IVF patients?
I think it's really important.
Similar?
Yeah, it's very similar, and because we again diving into the lifestyle, all the things, and we want to always include the the male partner. Like, as you know, the sperm is half of the equation,
Yes.
and sometimes
If you
the
ask my wife, she'll say it's about 5%. But needless to say, about a third of patients are male related, a
right,
third are female related, and a third
and
are about
or
50
both,
50. Yeah, both.
right.
So it is a huge part of
It's a
the
huge part
treatment
of
plan.
it. But not only that, I mean, you're passing on the
Yes.
DNA, right? And that's
Yes.
a big part.
Yes.
And sometimes the guys, they get left off on the sideline. And so I think it's
Or misdiagnosed, or, she's doing
exactly
treatment and then we do the semen analysis.
right.
And you find this. Well, in our last few minutes, I wanted to give you an opportunity to talk about some success stories that you've had about patients who combined acupuncture with kind of a holistic plan. You got a good highlight in the last couple of months that brings to memory that you want to share with our audience?
Yeah, I can think of a few. Let me
Just put you on the spot.
put me on the spot. Let's see. So there's a there's I'm trying to think of one with connected with IVF. So there's one that stands out for me. She actually went through IVF and she had 6 failed IVFs, meaning no embryos.
Oh wow.
Yeah, no embryos. And she was getting ready to do it again, and she came to me, and we worked together for 6 months with her and her husband. And then when she was able to do it, she did everything. One thing that they didn't catch this clinic is that they were both smokers, right? And then you wonder, she was older, she was 40, she was smoking, she wasn't eating right, all those things. And so when she came to me, we were able to like pinpoint that and do that pivot, and then she was able to get a healthy embryo. But so I just want
Yeah,
to
you took the
acknowledge
time
her.
to do a good history.
Yeah,
I mean, smoking is horribly toxic to the eggs and to the sperm. It's
right.
shocking that that was missed, but somebody has to take a detailed history, focus a little bit on giving care, not giving cure,
Right.
right? A lot of medical
Mm.
doctors are caregivers and not always giving care,
Mm.
and that's a great example of giving care.
Yeah.
So,
Thank you.
it's great to have colleagues in the field that will collaborate, take a few extra steps to help our patients. So I really appreciate you making the time to join us. Please contact Denise at AIM Women's Wellness Center. Is there a good website they can visit?
They can do aimwwc.com, aimwomenswellnesscenter.com.
Let's
And
do it.
yeah,
Go visit her. Denise Aris, thank you so much.
thank you. It was a pleasure.